what I wanted to do was to review where we were in light of all of the emerging information. Start with some general background information, then talk through some of the requirements and recommendations that we are seeing for in-person schooling. Then I'm going to switch to online or remote learning. Then I'm going to talk about some other options and the hybrid kinds of issues or questions that people have raised. Go through some special considerations, and then look at some additional or final questions as to where you should go from here. So that's sort of how I want to lay out today. I am planning to speak. It'll probably be about an hour, and then try to save some time during the last half hour for more specific questions, recognizing that I think everyone is really just trying to figure out right now what is the best option for their family. And that's really where I want to start, is by saying that there is no right or wrong answer in terms of what it is you are thinking about or considering for your child. Your situation is unique. Your child is unique. Their learning profile is unique. And so whether you're choosing online or in person or a hybrid or homeschooling, I think this is a judgment-free zone, right? We all have to make our own decisions about what's right for our families. So I'm going to start there, and then we will get into some more specific questions. So, what is the state of Ohio telling schools about the return to school? The state of Ohio has put together a guidance document, and I have linked to that resource here at the bottom of this slide. I'm going to show you, I have to stop sharing screen and then reshare a different portion of the screen. So I'm going to shift to that quickly and just show you how to locate some of these documents. This is the Ohio Department of Education website that you should see now. And off their homepage, you can click through to this Reset and Restart Education. In the Reset and Restart Education Planning page on the Ohio Department of Education's website, there is a planning document, and that is this document. It's a 36-page planning guide that school districts are supposed to follow in designing their programs. And there is also, if you scan down to the lower on that page, you will see that there are several resources that have either been published or are planned for publishing as it relates to COVID educational issues. So these guides right here are all related to special populations of students or special issues that schools are considering as they're putting their plans together. So this is the Ohio Department of Education's resource page. This is the planning guide here that I have highlighted. There are COVID-19 health and prevention guidance for Ohio K-12 schools. That is published by the Ohio Department of Health. So the Ohio Department of Education, through their guidelines, referenced schools to the Ohio Department of Health guideline, which is this. And both of those documents are informing school districts about the selections that they're making for fall programming. You'll see more specific guidance is included on this page for career tech education, for early childhood, for educator evaluations or OTES systems, for English language learners, flexibility with graduation options and credit earning, blended and remote learning considerations. This was just published today. Came out at about 5 o'clock this afternoon. The remote learning guide, social emotional learning, student readiness toolkits. This is my favorite, students with disabilities, coming soon. So we're still waiting for some specific guidance about how these plans need to be implemented to ensure that we're providing free, appropriate public education or FAPE to our kids. We're expecting some additional nuanced guidance on that particular issue any day now. We're not really sure when it's going to happen. So I'm going to stop sharing this screen. Just wanted you to see where you could locate those resources so that you could look at them yourself. And I'm going to switch back to the PowerPoint. All right. So what is the state of Ohio telling schools? The state of Ohio is basically leaving it up to school districts to put in place guidelines for both in-person and remote learning options. Some school districts are creating a hybrid model. So some school districts have 3 models, doing all in school, a hybrid between in school and online, and all online. Some schools are doing 2 of those 3 options, and some schools are just offering 1 of those options. Right now, there are very few schools that are not offering an online or virtual model, but I have heard that there are some. So the state of Ohio is allowing school districts broad flexibility to create their own plans. Schools are forming those plans through their own review of the guidance documents, through hopefully consulting with their parents, talking to their teachers' unions. I'm hoping those things are going on. I think they're happening more effectively in some school districts than they are in others. But schools have some pretty wide latitude in doing that. They are also advising school districts to align some of their planning to that 4-tier Ohio alert level system. And we'll talk about what that system looks like and how schools are aligning some of their planning to that tier system. Cuyahoga County, I believe Summit County, Franklin County, we're in red level, which is a level 3, which is a heightened alert. And so some schools are adjusting their programs based on where we end up on that alert system. Private schools, what about private schools, Autism and John Peterson Scholarship providers, homeschooling options? Again, private schools also have wide latitude in determining whether or not they're going to offer virtual or online options. Some are and some aren't. I'm hearing fewer private schools that are offering online options. Most of them are offering in-person options. Some of them are creating those virtual options, though. It's very school dependent. Autism and John Peterson Scholarship providers are able to provide either in-person or online services. The Ohio legislature has approved the extension of permission for all providers to do a virtual provision of services through the end of the next school year. Schools are not required to offer in-person options. Schools are not required to offer virtual options. Schools are not required to offer blended models. And so what we are finding is that as varied as the recommendations are, school districts are doing a lot of different things. So one thing you're going to have to do is you're really going to have to look at what your school, what your provider, what your school district is deciding to do, and then make your decisions within the parameters that are being offered to you. And so we'll talk about what those different parameters and options are looking like, and then how you can seek some additional information about how that might impact your student. One question that a lot of parents are asking me is that if a school district is offering a virtual option to all of their kids, can they exclude a child with a disability or indicate that a child with a disability must come to school? And the answer to that question is no. It would be a violation of federal law to offer a program to students with, or to all of your students, and then specifically exclude students with disabilities. But that doesn't necessarily mean that the services are going to be identical. So when we get into our conversation about what services might look like in person or online, one thing to remind yourself is that the virtual option cannot be excluded. So students with disabilities have to have the same opportunities as all students. So the opportunity to participate in virtual learning has to be available. However, the provision of services may look different because of the different need of the student. We'll talk about that. Are there exceptions to the requirement for schools to provide Vape? No, neither the state or federal government has indicated that through any of this planning, school districts are given a waiver or an exception to the need to provide a free, appropriate public education to students. There are no Vape exceptions because of COVID-19. That also applies to timelines. We are expecting that in the guidance document for students with disabilities, we're going to see some flexibility for doing more online testing. The Ohio Department of Education has already said evaluations can occur, if possible, through remote or online interaction between the evaluator and the student. It isn't necessarily recommended. It's not always best practice, but it's possible. And so we're looking at some of those timelines being impacted that way. We expect that IEPs will still be developed in a timely manner. Those deadlines will still be met. We expect that those meetings will continue to occur online and via Zoom conferences. A lot of school districts are proposing that visitors not come into the building. They're trying to control how many people are coming in and out. So we're finding that visitors, which would include parents, would be considered not able to come into the building. So a lot of these meetings are still going to happen remotely. And one question that people are asking me that I do not have an answer to is, who's responsible if our kids get sick? Who's responsible if our teachers get sick? If we reopen these buildings and everybody comes back and people start getting ill, are we going to be able to hold schools responsible, or are teachers who get sick from kids going to be able to hold kids responsible? I can tell you that there is not an answer to that question yet, but we expect that most legislative bodies are going to provide some exceptions and some waivers to that kind of responsibility. I think that in dealing with a pandemic, it's very difficult to hold individuals responsible for the transmission when it's going to be impossible to prove really where the person got sick or who they got sick from. I expect that we will probably see waivers for any liability for schools, for students, for teachers, so that there's not a personal liability associated with the transmission of the disease. So those are some of the things that we are anticipating. These are the kinds of conversations that we're having with school districts and school district attorneys right now. We're, as a firm, talking to school district attorneys and saying, hey, what are you telling your clients? We are really focusing in on how we can advise our clients to ask some of these questions. And so, although we still have some unknowns, as your schools are releasing their plans, we can start to see how the plans may be applied individually to your kids. So that's what we're looking at. I want to start with looking at in-person instruction. So what you're going to see on this slide is a lot of considerations. These are the things that we are considering as we are looking at bringing students and staff back into our school buildings. And before I really get started on what some of these details are, I kind of want to address from a global perspective that I recognize that people are scared. I think that we are seeing a lot on social media. We're having a lot of conversations with parents and teachers about how worried they are about coming together into a building where they're going to be together for a long period of time, with some students who may have difficulty with social distancing and wearing masks and taking safety protocols. So I want to be really sensitive to how people are feeling about that. I'm going to be talking about facts and details, not really my opinion one way or the other about whether we should be doing this or whether we shouldn't. But I just want to be sensitive and acknowledge that these conversations are occurring. And I think one of the ways that schools are trying to be responsive to those questions is by looking at aligning the availability of in-person instruction to this 4-level Ohio alert system that they've created by county. What I'm starting to see from some school districts is that when you're at level 1 or 2, we're going to have more in-person opportunities for instruction. Some schools are coming out with plans that are 5 days a week, all kids in class, with about a 3-foot social distancing mandate if the county is in level 1 or level 2, which is a less active risk of exposure. Those districts that are aligning their plans to the levels are then typically going into a level 3 where there's more of a hybrid approach, where schools are part-time at school and part-time at home so that they can expand the social distancing, have fewer kids in a classroom at a time, and try to reduce the risk of infection by decreasing the number of students in the classroom. Some school districts are saying that if a county goes into level 4, we have severe exposure or spread, that they will then go to a all online model. And I think they're trying to do that in response to some of these infection concerns. I think it's an interesting approach, and one that you may want to ask your district, if their initial plans don't get into this level of detail, whether they may be adding some detail that would align to that exposure level. So what are the state requirements to reopen? Again, you are welcome to look at the Ohio Department of Education and the Ohio Department of Health guidance documents specifically, but there are very few set requirements. Most of those documents reflect considerations that schools have to review while making their own decisions about how these things are going to be in place. So there are, again, very few requirements, a lot of considerations. The role of the county level system is a consideration. Some of the typical safety protocols that are being recommended and that we're seeing widely adopted include wellness checks. So both teachers and students would conduct a wellness check before they come to school. Parents would be expected to work with their children to complete the wellness check. The wellness check will include a temperature check. Anyone who has a fever of 100 degrees or more is not supposed to come to school. If they're showing other symptoms of COVID, including coughing, shortness of breath, some of the other symptoms, and they're outlined in the guidance document, you're expected to stay home. They're also engaging in increased sanitizing procedures. So we are looking at sanitizing rooms between students. We're looking at wiping down bathrooms, hallways, stair rails, doorknobs, desks on more like an hourly basis or every couple of hours, a much more frequent basis than they would normally be cleaned. There have to be hand sanitizer throughout the building, frequent hand washing expectations. They're limiting the number of students in the bathrooms and in the cafeterias. Some cafeterias have been transitioned into classroom spaces so that we can, again, socially distance our children more effectively. So those are some of the basic things that schools are doing to try to create a more sanitized environment. Two other things that they are doing include social distancing and the use of masks. So I want to deal with both of those in order because I know for some of our population that can be very challenging. Social distancing right now, what is being recommended by most of the guidance that we're seeing is a 6-foot social distancing. When there is a reduced likelihood of transmission, that can be reduced to 3 feet. That can also be reduced if you are using plastic dividers, if you have older students who are less likely to violate social distancing requirements. But again, that is not a hard or a fast rule. These are just recommendations. You'll see that I linked here, what about young kids? There is a lot of information within that specific topic under Reset and Restart Ohio on ODE's website for early learning and school readiness and trying to maintain and teach distancing at that really early level. I am not going to pretend to you that it is going to be easy to try to socially distance little kids, individuals that don't have a sense of their own space. I think social distancing is going to be complex for some of our more involved students, and social distancing is going to be very difficult or impossible if a student is requiring one-on-one or hand-over-hand instruction or while receiving related service therapies. So I don't think that the requirement for social distancing is absolute. It's a recommendation. And I think that in reopening schools, there's going to be an expectation that some of the services are going to have to be provided with closer student to teacher contact than maybe everybody is initially comfortable with. Those are some things that you may want to talk to your IEP team about if you're looking at in-person services, but your child services would have them in close proximity to an adult. How are we going to maintain good safety measures in that situation? I also want to talk about masks. Masks are very difficult, I think. This is a tough conversation. But what we are hearing from our healthcare professionals is that masks are really our only line of defense right now to exhaling or inhaling particles. So most schools are requiring masks. Some school districts or schools are reducing that requirement or easing that requirement for younger students and students with disabilities, or students that have difficulty wearing a mask for health-related reasons. There is no statewide rule. Again, this is just a recommendation. If the kid will not wear the mask, if you're not going to be able to keep it on, if they have an age or medical or developmental reason, they're not going to be excluded from school for that reason. That would be excluding a student on the basis of disability. There will have to be waivers and medical exemptions in place. Typically, a doctor's note for a medical exemption would be required. I think all of our schools and teachers are committed to trying to work with kids as needed to try to facilitate mask wearing. I think we recognize that there are going to be some kids that just can't or won't keep them on, and we're going to have to understand and allow those students some flexibility. There has been some conversation about the use of face shields in lieu of a mask. And so a face shield is a plastic piece that would extend usually from the forehead on some kind of headband or brim, then down under the chin and around to the side, so it would prevent the transmission of spray. Face shields are a really nice option, I think, for some teachers so that their students can see their speech, they can see their expression. I think it's a good idea for a lot of individuals that have a hard time wearing the mask, or they feel they have difficulty breathing with the mask. So I think that a lot of schools are looking at face shields as an appropriate alternative. Can a child be forced to go online because they cannot wear a mask? No. Can a parent be forced to transport their child to school because they cannot wear a mask and masks are required on the bus? Again, no. To the extent that a child with a disability is going to have difficulty wearing a mask, the district is going to have to work with you on alternative transportation arrangements or a waiver to the mask requirement. Infection and quarantine. If students are in school and someone is testing positive or they've been exposed to a known case of COVID-19, what are the requirements? So there are some specific requirements that are listed in the Department of Health guidance document, and there is a link through that document to the CDC guidance about if you are sick, when you can end home isolation. So I've added that link to this slide. Typically what we're going to find is that if you have been exposed to a known case of COVID-19, that you will be asked to quarantine for 2 weeks. And that would typically include if someone in the classroom were diagnosed. So if a student or the teacher were diagnosed, we are expecting that most districts are going to require a quarantine in that situation. If a student has been exposed in an alternative setting, like at home, so somebody at home has COVID, we would expect that the student will stay home during that 2-week quarantine period so as not to expose other students or the teacher in the classroom. Are you going to be required to disclose a positive test within your family unit? Again, you'll need to refer to your particular school's documents. Most schools are requiring that disclosure and requiring that any student who's been exposed or is showing symptoms as a part of that initial wellness check that we discussed, stay home. If quarantined but asymptomatic, can the child go to the online learning platform? We're not sure. Again, that's going to be very school dependent. So you're going to have to work with your school to figure out what the child's expected learning profile would be during a period of quarantine. This is not easy stuff. IEP service delivery considerations. Obviously, the reason that most families are considering sending their kids to school is because they need to be there to get the richness of services, to get the in-person instruction, to have access to their teachers and their social opportunities, and to be with other kids. IEP service delivery considerations today, what I'm being told, is that schools are expected to deliver the IEP as written. That even if the school is in session only part-time or under a hybrid model, that the IEP services are expected to be delivered as written before everybody went in on a COVID restriction back in March. So we would want to be taking a look at the IEP services that are expected to be delivered for full-time enrollment and instruction. Recovery services, sometimes called compensatory education services, are services that the child may need as a result of having lost or missed instructional time during the period of COVID closure from March to the end of the school year. So we will also be looking at whether or not a student will need to be delivered those sort of services when students get back to school. I'm going to talk about that a little bit more when we get to our part 3 out of 3 session in August. I think that right now our focus probably needs to be on what school is going to look like next year. And then when we get closer to August, we'll talk more about the recovery service or compensatory education idea. Ongoing services, again, those services, we need to make sure that they're going to be provided regardless of whether we hit this level and have to go into either a hybrid or an online approach. So I'm encouraging students to have conversations, parents to have conversations with their students' IEP teams about what that might look like. Extended standards, I think for extended standards, again, if the IEP is going to be delivered as written, those students who are in-person instruction should continue to have access to that curriculum without really any difficulty. I think some of our related services providers are particularly challenged when providing services in person during this time period where social distancing is supposed to occur, particularly our therapists, like our occupational and physical therapists, that usually have hand over hand or close physical proximity in order to make sure that those therapy goals can be achieved. At this point, those therapy goals should continue to be worked on. I think, again, IEP teams may need to meet to consider whether or not those therapy goals should continue to be prioritized, but that is not a decision that either the school district, the therapist, or the parent can make unilaterally. So our IEP teams are going to have to meet and have those conversations about whether it makes sense to prioritize maybe some of the students' other therapy goals. Transportation for in-person instruction is going to be another challenging key piece of this. Most transportation and busing is going to be reduced. Many districts are going to providing the bare minimum of transportation, which would be K through 8, students that live more than 2 miles away from the school. Schools will have to continue to provide transportation to students who attend private schools to the extent that they had to do that before the COVID-19 restrictions. So that's a whole nother talk about when that's required. But if your child was getting transportation to a private school before now, they should still be getting that transportation. There are some special considerations for students who are in outside district placements on their IEP. So particularly for kids with autism, there are several autism schools that operate in the area, and several parents that have their kids in outside of district placements. What I'm going to tell you is that those placements are supposed to continue. Transportation is supposed to continue. To the extent that the private school may not be offering the same kinds of services that you have come to expect because they've switched from an in-person to a virtual model, or they're only operating in person 2 days a week or 4 days a week. Those are some significant conversations that you're going to have between the private school and your public school district. The reason for those placements tend to be because of the richness of the services that are offered. And I think you're going to have to ask yourself some tough questions. If the services aren't offered that way, is there something else that we should be considering as an IEP team? And I'm not suggesting that the private schools that are not opening full-time are doing the wrong thing, because they're trying to maintain appropriate social distancing in very difficult situations, often with students that are struggling to do that. So I think that you may need to consider whether or not supplemental tutoring might be necessary. There are a lot of considerations for students that have that level of need. And I just think an open conversation between the private school, the public school, and the parents need to occur about how we're going to still provide a free, appropriate public education in light of the decisions that those entities are making about how they're going to provide service. It is still the obligation of the public school district to provide a free, appropriate public education to students who are placed privately on their IEPs at another facility. So they're going to be heavily included in that conversation. So what about hybrid models? And I'm putting hybrid models down here and not as a separate slide, because the hybrid model is going to include elements of both the safety and in-person instruction and elements of the online remote learning. To the extent that a district has a hybrid model that the kids are going to go back and forth between the two, that's going to be very specialized by district. Blended learning or hybrid learning models, the district is required to put together a written plan and put that on file with the Ohio Department of Education. They're currently working on those plans. They're not due to be submitted for several months, even though they're going to be implemented a little bit early. So I think you're going to have to really ask your district how they specifically plan to implement it. What is the online model? And when we switch to the online slide, I think you'll start to see the kinds of questions that you're going to want to ask about how the online parts of that hybrid model is going to be delivered. Some schools are separating out the subject matter that's being addressed in school from subject matter that's going to be online. Some schools are doing 2 full days in school and then 2 days online, where it's going to be more of an independent work model. So there's very different considerations for students depending on the decisions your district is making. So those are some of the questions that you're going to want to focus on if your district is going into a hybrid model. Online or remote learning plans. What I have here on this screen, and one thing that I want to talk you through, if you see the multicolored 4 steps across the top of the screen here, teacher-student interaction through an online learning platform. This is a continuum of remote learning plan options. So when school districts say they're going to have an online option or a remote learning plan option, they're talking about something on this continuum. Again, every district is making their own decision about where on the continuum their online program is going to land. So you'll notice when we're talking through these options that some options sounds pretty good and some options sound like it's a lot of independent learning. And where on the continuum your district is in how they're going to do online may significantly impact your decision about whether or not you're going to put your child in an online or in-person program. So knowing how to ask these questions is really important. If you look all the way to the left of your screen, we have a teacher-student interaction through an online learning platform. This is going to be a teacher on one side of the computer, a student or several students on the other side of the computer doing actual lecture, interaction, direct instruction. That is the most involved and probably the most direct instruction kind of model of online learning that schools are considering. The second model, or the gray model, include online lessons for students to work on at home. So they're going to have perhaps a complete remote pre-packaged kind of curriculum where they're doing online classes, online work, and there'll be some lessons that they'll watch either while offline or while the teacher is working with other students, and then they'll have some work to complete of their own. The yellow kind of piece on the continuum are offline lessons and instructional packets. So here what we may see are kids are coming to school for the hybrid model, so they're in school for 2 days a week. And then the 2 days that they're out of school, or the 3 days that they're out of school, they're actually doing offline lessons. So there's some recorded lesson that they're watching, and they're completing instructional work to resubmit to school. And then the blue sort of end of the continuum are these student-teacher check-ins. And I think this is what most people experienced during COVID early closures, where the staff kind of assigned a bunch of assignments, or they would create links to worksheets, and there were some assignments that were posted maybe in your online student platform. The student was expected to open it, complete it, print it, send it back in, but there wasn't a lot of direct instruction going on. Again, I said some schools did a lot of direct instruction, and so looking at where on this continuum your district's virtual learning plan falls is going to give you a lot of information about how much interaction we can anticipate if our child is doing the online or remote learning plan from the staff at the school. So are we going to have, multiple hours a day of directed teacher-student interaction? Or are we going to be getting a list of assignments to complete and then just having a brief check-in for 20 or 30 minutes to see if there were any questions? So I think you can see where that's a very different plan. So what is Ohio requiring schools to provide? Again, not much in terms of the area of what's required. There's a lot of guidance, a lot of suggestions, and a lot of things that districts have to consider, but there's no set requirement. Districts are in the process of developing their remote learning plans. I think they're going to have to start to answer some of these questions for families, particularly because they're asking you to make a selection between being online and being in person. Some of this information is really critically important for you to know before you make that selection. So again, not a lot required. There are a lot of recommendations, and you can go back to ODE's website, the Restart Ohio page, and there is some remote learning planning information there that you can review if you're wondering what kinds of considerations they should have in place. Will online look the same in the fall as it did in the spring? I don't think so. I think most schools are really looking at the higher end of this continuum. I think they're looking at rich teacher-student interaction through online platforms and set complete curriculums that may be available online. So I think we're talking about much more teacher-driven instruction than what we may have seen in the spring. And so again, in the spring, because every district did it a little different, it's hard for me to kind of weigh in. What you're really looking for, I think, for most kids with disabilities is what is the specially designed instruction delivery option going to look like. So if I choose an online or remote learning option for my student, how are we going to get the direct instruction piece taken care of? What is that going to look like? How are the IEP services going to be delivered? Is that going to be an interaction with the special ed teacher or something else? So how does the age of the child impact this decision? Obviously, you know your kids the best. You know if you've got a student who could be a little more independent, who can access online a little bit more freely, who has the ability to navigate the technology and attend to the technology more efficiently. Schools are really struggling to put together appropriate online remote learning options for students that are very young, because students that are very young tend not to attend to that kind of instruction for a long period of time. And so, I think that those questions are going to be really important when you're reaching out to your district to find out more if you're interested in this online learning option. Districts will have to track attendance for students online. So I think you're going to find that there's going to be much more directed interaction, much more consistent interaction between the school district and your child than what you may have experienced earlier. IEP delivery service or service delivery considerations, again, even in an online or remote learning plan, districts are expected to deliver the full complement of IEP services. If you're like me, your head is kind of spinning about how that's going to happen. And I think that teachers and districts are grappling with that same question. I think it's going to take a lot of communication, a lot of patience, and a lot of trial and error to make sure that we can try to do this the right way. I am expecting that most of the teacher-student interaction will occur through the delivery of direct instruction from a special education teacher to a student with a disability. I am also expecting that related services will be provided, again, via some kind of online direct service delivery model. Ongoing services, recovery services, we'll talk about that again when we get to August. Delivery of extended content standards. I think that that's going to be a particular challenge. I think it's going to be a particular challenge for students who have difficulty attending, but it's possible. There are significant online learning modules that are available through a variety of different strategies to teachers. So a lot of it depends on the platform and the continuum that the district is selecting and the flexibility with which the teachers are going to be given to implement the curriculum in addition to the IEP related services. Students who are going to participate in remote learning plans are going to need access to devices and the internet. The Ohio Department of Education has indicated that districts that have remote learning plans have to ensure that students who access the plan have access to the devices to make it work. That does not mean that every school has to give every student a device. It does mean that they have to ensure that the student has an available device. So you can use the one from home, and typically the internet service provided at home will be adequate to enable the child to access the online option. What should data collection practices look like? I really am heavily encouraging teachers and schools to do data collection via teacher-to-student direct interaction or through specific targeted IEP data collection assignments. So if there are very specific instructional targets on a student's IEP, which there should be, right? We are recommending that data collection be set up either through the provision of specific assignments for data collection procedures or individual student-teacher interaction via an online platform so that teachers can observe the student completing the work independently or under whatever conditions are required by the goal or objective. What about delivery of related services? I think this is something that parents are going to have to be prepared to really review and consider how this is going to be done. Districts are not going to be obligated to send a physical therapist or an occupational therapist to the house unless there's some kind of medical related reason that the child cannot come to school. So there's a difference between a child who cannot go to school and a child whose parents are electing to do online instruction. So one is going to be a home instruction candidate, and that's going to look like a very different IEP process. So a student who medically is not permitted to come to school because of particular susceptibility to COVID-related issues, you're going to want to convene an IEP team and talk about the need for revisions to the IEP to address home instruction issues. And that's going to be instruction provided in the home by the district because of a medical issue. There is going to be a relatively high threshold to qualify for that. And so I'm going to advise you that if you have that issue, you're going to need to work with your doctors, and you may need to work with an advocate to try to secure that kind of service. For families that are electing to be online and at home because of their concerns, there may be the need to revise or review a student's IEP to address some targeted instructional elements that may not be available through online instruction. So if it's an election, there may be some changes to the IEP that are needed in order to address goals that simply cannot be delivered through that model. However, districts are being advised that if the goal, the objective is able to be provided through an online model through direct instruction, that it should be done that way. All right, will students who elect an online or remote learning model have access to sports or clubs held in the school building? The answer to that question is going to be very dependent on your school's plan. Schools are required to address that issue in their remote learning plan. There is no answer that they are required to provide you. So because most families are electing to do an online or remote learning plan because they have fears of exposure to COVID, it is happening that many school districts are saying, if you're online for school, you're not coming to school for clubs and sports and those other things either. And I can understand kind of the rationale for that. If you're concerned about being exposed, you're concerned about being exposed in that setting as well. But I can also understand where some families are looking at, there's a difference between perhaps 1 hour wearing a mask after school to participate in an activity versus 6 or 7 hours a day in the classroom, having to have that kind of restriction. So again, I think that if this is a key issue for you, then you're going to have that conversation with your child's district about this rule, whether because your child has a disability, there may need to be a waiver or some kind of adjustment to that rule. And this is all really new and really tough stuff. So I am trying to kind of give you the big picture, but this big picture is just not able to be answered with easy yes or no answers. You know, when we're talking about kids with disabilities, there are a lot of considerations that we're looking at when we're making these decisions. So we have the intersection of a lot of different laws going on. So we have IDEA, which is the law that provides for the IEP process and special education services. But we also have non-discrimination laws like the Americans with Disabilities Act and Section 504 of the Rehab Act. And those two rules require non-discrimination. So if there's an impact to a student because of a disability that may be different than an impact to a general education student, there may need to be a conversation about that. So we're looking at some really complex issues that we don't necessarily have an answer to, but I wanted to respond to some of these concerns as you sent in these questions about what this is all going to look like. And I'm sorry if I'm giving you more questions than I am answers. I'm hoping to give you a framework within which you can make a decision for your family. And that framework often has more questions than answers. And unfortunately, only you can decide where your level of comfort is with all of these moving parts. I have spent really the last 8 weeks working on trying to put some of these elements in place and trying to kind of work in my own head about how this is going to work for different kids in different scenarios. And so I can appreciate how challenging these decisions are for families. So what should parents do? Are there any other options? So the one thing I just want to say and remind everybody is that this is just an intensely personal and complex decision. There is no right or wrong answer, and it is only about what is best for you, your child, and your family. What your neighbor may decide to do or what your friends on Facebook are talking about have no bearing on this decision that you need to make as a family, considering all of your particular circumstances. So I want to free you from the obligation of considering what everyone else is doing and really just make a difficult decision for yourself. Some other options that I'm hearing about parents considering that I just kind of wanted to address quickly. What about enrolling in an online public community school? So I have had a couple of families who have come to me and said, my school is only offering in person and I'm just really not comfortable with that. What else can I do? Or my school is all online and I don't think that's going to work for my kids, so what else can I do? So if you feel like your options are limited, these are some things that you may want to consider that are outside the box. There are online public community schools that are 100% online. Some caution in making that decision is, as a public school option, the responsibility for a free, appropriate public education would transfer to that new online school. Online schools do provide intervention for students. They are obligated to provide online services and online programming for students with disabilities. Some have some in-person limited services. So if this is something you're interested in, you may want to consider it and start looking at the different available options. One other note is that if you go to an online public school, you cannot also take a scholarship. So if you're looking at a scholarship program under either the Autism or John Peterson Scholarship, you can only do that if you are not enrolled in a public school. So again, you can't go into an online public school and also take the scholarship. Excuse me. Another consideration I'm hearing people talk about is doing homeschooling. So homeschooling is an option for all parents. And homeschooling is an option where you as a parent assume responsibility for the instructional design, implementation, and curriculum decisions that you're making for your child. It is the responsibility purely of the parent. The district no longer has an obligation to provide Vape. You can, however, combine a homeschooling program with a decision to take a scholarship. So you could potentially create your homeschool program and then take the scholarship to help you find a scholarship provider to help you provide disability-based services that are reflected in your IEP. So that may be a way that you can combine some options to provide some services for your child. The third option would be to look at an Autism or John Peterson Scholarship program. Just a couple of considerations to keep in mind as you're looking at that is you either have to enroll, if you take the scholarship, your child still has to be enrolled in school. So if the scholarship provider that you choose is not a school, you will have to homeschool the child, do some homeschooling paperwork, and then enroll the child in the provider. Most providers can support you in working through that kind of program. And again, taking the scholarship for the Autism or John Peterson Scholarship Program does require you to provide a waiver of a free, appropriate public education to the school. And you may also have some limitations. You may have the same limitations going to another private school or to a private provider as you do in your school district in terms of what their in-person program looks like or their online program. So some of these are choices and options. If your public school or the school that you're currently attending isn't giving you the option that you're looking for, these may be some other strategies or paths for you to create that option. And again, you can create that option, and then once, hopefully, we're over the COVID-related issues or closures, you can look again at returning to a more typical or normal school placement. I think that these options may have the potential to be pretty disruptive to our kids if they're not already enrolled in some of these options. I just want to caution parents to consider who your child is while you're making the decision, whether they do well with changes. They've probably been through so many already. You know, what is going to be the best choice for your family? There were some final questions that people had submitted that didn't really fit into one of these other things that we had discussed. So I wanted to go through some of them. Have schools received any funding from the state or federal government to help offset the cost of these changes? The answer is yes and no. So there is an allocation of funding from the federal government under the CARES Act, specifically for public schools and nonprofit private schools. So some of your schools who are for-profit have not received those funds, and those funds have not yet been released. And so there's a promise of funding, but not necessarily an actual receipt of funding yet. That funding is also offset by many of the cuts that the governor made at the end of the school year last year to last year's fiscal budget. And so I apologize, I have to sneeze again. The short answer is there is some money coming to our public schools. It is not a lot of money. It is unlikely to do much more than fully offset the cuts that were made last year. And I really think that in looking at additional funding from the federal government for COVID-related issues, we really need to be working with our legislators to ensure that they are seriously funding some of the things that schools need to be doing to make it safe for our kids. Whether that means funding additional resources for our schools, for safety equipment, for additional teaching staff to support people that are going to be perhaps out of school under quarantine, to provide some additional support in the classroom for students that have to be socially distanced, whether it means putting together a curriculum that is online or hiring additional staff to fulfill that. We need to be talking to our legislators about how we can support our teachers and our schools in doing some of these things. Will athletics and extracurricular activities still be held? Your guess is as good as mine. Right now, the Ohio High School Athletic Association is putting plans in place. We have teams that are practicing. I'm hearing that bands are, marching bands and bands are starting to practice. I think we're starting to see some of these things come back to the table. However, activities like field trips, school dances, activities that would bring large numbers of students together, those are probably not going to happen. Many schools have discontinued some of those activities for at least the near future, hoping that we can bring some of those things back as we get to the end of the school year next year, so that our students can start to experience some of those more powerful opportunities, particularly for our kids at the high school who've missed out on things like prom and graduation. Is there any guidance for schools yet on how to determine compensatory or recovery services for students who experience COVID-related regression? No, not yet, which is why I'm postponing talking about it a lot until August. You'll remember that when I showed you the Ohio Department of Education screen, the link for students with disabilities still said coming soon. We're hoping that that document will provide that guidance. And are non-public schools and scholarship providers permitted to provide educational services through remote learning plans? The answer to that is yes. There was a House bill that was passed that allows providers, scholarship providers, and non-public schools to continue to provide services through remote learning plans or through the Zoom platform model through the end of the following school year. So we have at least through this coming school year where those options are still viable and available to scholarship providers and to private schools. All right, so after this presentation, you probably have more questions than you started with, and you really need more details from your school district before you can decide between in-person and remote learning. At least I felt that way as I was putting this presentation together. So what should you do? I'm going to tell you what I did. I called the school district attorney and I said, I'm presenting to a bunch of parents tonight and they're all going to want to know what they're supposed to do. I want you to tell me what you think I should tell them. And what this school district attorney said to me was, I'm going to tell you what I'm telling my people. And it's that parents need more information before you ask them to make these tough decisions. So when they call you for it, be open with them about it. Because we're talking about particularly special education services, I think for most of our kids, I think you should start by reaching out to your IEP coordinator. If that person is a teacher and they're out for the summer, I would go kind of one level up. Look to your special education coordinator or even your district pupil services director. I would reach out to them via phone and email so that you have both kind of this direct personal connection as well as a documentation of the attempt. And what I would say is that I really need to schedule a phone call with you to review some of the options. I have some questions about how you plan to deliver special education services under both the in-person and the remote learning option. Can you please schedule a phone call with me? When you have that phone call, I would then ask your questions. How will special ed services be provided in person? What if we're in a hybrid model? What if my student should come every day and you go into a hybrid model? Are there opportunities for students with disabilities to come in more frequently? How will you deliver special ed services through remote learning? What are the things that you're considering? And then if you start to get the feeling that you really need an IEP team meeting to look through your specific goals and objectives, your particular services, and how they can be implemented before you make a decision, then ask for that. I think it's going to be difficult to schedule full, complete IEP meetings for every kid before school starts. So I want to caution you that you may be asked to waive certain participants in the meeting to try to get something together so that you can get those answers. A lot of teachers are not under contract over the summer. A lot of our related services providers are not under contract over the summer. And while some are more than willing to come in and participate in meetings, they're also exhausted and really struggling to plan for their own obligations for this coming year. So I would encourage you to try to be as flexible as possible if you feel the need to have some of these questions answered as you go into making a decision about in-person or remote learning. I just wanted to let you know here, we're going to have one final presentation in our three-part series in August. I expect that session 3 will focus on what's changed, because I expect things will change between now and August, and then I expect they may change again before schools open. What has the Ohio Department of Education released? Has anything changed through the Ohio Department of Health requirements? What did we learn about compensatory and recovery services? And is there anything else in that Students with Disabilities resource guide that we're waiting to be published that we need to consider as we're looking toward school reopening, or after school reopens, as we're looking at providing services to students on an ongoing basis. Before we switch to questions, I just want to make a couple of final closing statements. So the first thing, again, is this. I'm just going to remind you, just do your best to make the decision that you are most comfortable with. Again, I would not worry about what everybody else is doing around you. I would really focus on what's right for you, your family, and your child. Number 2, I'm encouraging everybody, whether you're a teacher, a parent, a scholarship provider, whatever your role is in the world of special education, to continue to be patient. Everyone is really trying hard to come up with plans and to be mindful of all of the different populations that they're dealing with. This is really difficult, and as someone who's been trying to put these policies together for some scholarship providers and some private schools for the last several weeks, I can tell you that the guidance documents are still coming out. They're still changing. Even little nuance changes, like what the temperature guidelines should be. Early guidelines were 100.4 degrees, and now they're 100 degrees, but some documents still say 100.4. So, and that kind of level of nuance is still going on. So be patient with one another, be kind to one another. Try to get your questions answered. Again, I wouldn't wait until August 29th to ask a question. Most of our administrators are working full-time this summer, particularly in light of all of these issues. So don't be afraid to reach out, and don't be afraid to request to get some of your questions answered. Look at your child's needs critically, prioritize those needs. Look at the IEP services and how your child should be receiving those services. Think in your mind what you think that might look like if you're looking for an online delivery model. Talk to your district and look at those options. I think I am going to hit stop share on my screen so that we can bring Lisa back, and I can get to answering maybe some of the questions that people posted while I was in my like hour and 15-minute long stream of consciousness lecture. I like to talk, but boy, that was a lot of information in a short amount of time.
It was, but it was great information, and I do feel that you provided information that answered most of the questions that we had. But I agree, you definitely gave people information though that they need, because most of us don't know what we don't know. So these are the kinds of reasons why we put these things together. So I did see a couple of questions. I'm going to ask them to you from the chat. So one
Yep.
person asked, can parents request an IEP review to change the location of services to the home if they feel that remote learning is not their least restrictive environment?
I think that you're going to probably need some documentation as to why that decision is being made. So home instruction is a very, very significant change on the continuum of least restrictive environment options, because home instruction tends to isolate students from any other interaction with their peers. And so a shift on the continuum from an LRE perspective from in school to home instruction is a very significant change. And that's why I'm saying for students that have a medical diagnosis or reason for not being in school, that's going to be a different issue than students who or families who are electing to go to an online model because they have concerns about exposure. So I think there's a difference between concerns about exposure and a student who has a medical condition that puts them at increased risk. And that's where that distinction is going to be a little bit different. And I wish I could tell you that, getting home instruction as a least restrictive environment was something easy to do, but it is not.
Gotcha. Another question is, someone is considering homeschooling. They're wondering what scholarships they could look into.
So if you are homeschooling, again, that means you're taking on responsibility for instruction in all areas of education. So you would create your own homeschool program for all of the curricular areas. You could look at scholarship programs if you have a child on an IEP. The Autism Scholarship or the John Peterson Scholarship Program could be available to get your IEP related services or the special education services that you would need to support your general curriculum through homeschooling. Depending on your child's category of eligibility would depend on which of those scholarship programs. Obviously, the Autism Scholarship is for students who have an autism category of eligibility. The John Peterson Scholarship includes category amounts for all students, for all categories of eligibility in special ed. Now, there have been some questions and concerns, and I think we're still working with scholarship providers in the Ohio Department of Education over funding allocations for some of the categories of eligibility and the provision of online services. So that is still an ongoing conversation. The department has indicated that they may be looking for scholarship providers to reduce or alter their fee schedules, but that is not something that we've gotten a lot of guidance on, and I'm working closely with a couple of scholarship providers about that issue. So you're going to want to be in conversations with your scholarship provider about how the services are going to be provided and what those fee schedules might look like if the services are all going to be remote.
That's a question further down. Someone is asking, the Autism Scholarship Program fact sheet has been updated with a caveat that the amount could be reduced.
So we, the scholarship amount in terms of the budget, I have actually not heard that there has been any legislative action So that's one of the arguments that we are currently having between scholarship providers and the Ohio Department of Education, because the scholarship allocation is the same. It's how the providers are permitted to bill the service and what that service rate can be that is changing, or that we are being told may change, but we have not received any additional information. So maybe that's something we can look at in August if we get any updated information.
Okay. Let's see. Have you heard if parents choose remote learning only, if they should go ahead and fill out free and reduced lunch forms?
Yeah, so we are seeing that there is a real push through remote learning plans for district to maintain the provision of free and reduced lunch options for all students. And so to the same extent that schools were still providing lunches and food service to students when they were on COVID closures, we expect that those same options will be available to students if they have a remote learning option that they elect in the fall.
Okay. Let's see. Remote learning in their district of residence, I guess, is what the reference is, because this person has several families choosing this option but qualify for free and reduced lunches.
Mm-hmm.
So
yeah, it would be within their district of residence. Again, that's if they're doing the remote learning through their school district's online option. So again, if you're enrolling in a separate public online school, so you're going from doing a remote option with your district to enrolling in like K-12 online or some kind of online community school, that may not be an option. So it really depends on how you're getting there. But I would encourage you that if your district is offering a virtual only option and it's an option that you think your child could benefit from, then you would probably want to go that route.
Here's a question about Vape. Is the Vape requirement for preschool the same as K through 12?
So that's a pretty broad question. The requirement as to whether or not a student receives a free, appropriate public education, the inquiry is the same. So it's whether or not the district provided appropriate, specially designed instruction designed to meet the unique needs of a child with a disability as determined by their ability. So whether or not a child receives FAPE is going to be the same whether they're 3 years old or 20 years old. So whether or not the least restrictive environment might look a little bit different, because kids are very different at age 3 than they are at age 10 or age 18. So I'm struggling to answer the question a little bit because I think it's probably a little more nuanced than whether or not the FAPE requirement is the same. The test for FAPE is going to be the same.
Gotcha.
And so, yeah, feel free if there's a more nuanced question there to email me. My email address is going to be on the last page of the PowerPoint.
And then it looks like any guidelines regarding students who would have needed one-on-one aid support throughout the school day, and now the parent will need to provide that support. Can parent training be given?
Yeah, I think that's a great question for your IEP team. I think that parent training is always a good thing to include on an IEP, and particularly where you think some parent training may be needed to support your student in accessing the remote learning options. That is absolutely appropriate for your IEP meeting conversation.
And then the last one here, could there be an option of remote learning and travel for related services into the building versus Zoom or virtually?
So there could be. Again, every district is creating different rules as it relates to these options. And so that's kind of one of those situations where some schools are saying the general rule is that you're either all online or all in school. But that may be kind of a situation where you're like, well, maybe the general rule, there should be a modification to that rule for a student with a disability. And that's a difficult conversation, but that's a conversation under the ADA or Section 504 about whether they should create some kind of exception to a policy or procedure in order to service a student with disabilities within their program. So I think that that's a conversation that you should have. I think it's a conversation you should have with your IEP team. And it's going to be a challenging conversation if districts are not being creative. I think that there are a lot of providers that are open to that kind of model. Like I think our related services providers, OT, PTs, I think they'd be open to it. I think it's going to be a difficult thing to manage across a district if kids are coming in and out. You know, how they would do that, it's possible. Absolutely, it's possible. So again, it's how creative are we going to be, and how flexible our district's going to be in looking at creating options for kids.
We have lots of thank yous for the great information. So thank you, Kerry.
You're welcome.
Wonderful, good information. And I just want to remind everybody that tomorrow at some point, I will send an email with a link to the recording and the PowerPoint slides, as well as some other things that are in the presentation. Feel free to, if you need help with anything, call our helpline. We have a support specialist on staff, so she can help you work through some solutions or connect you with resources. We definitely don't want you to ever feel like you're alone. So yes, you will get an email to sign up for the next segment. So yes, anybody who attended this one will get into our system and start to receive. We have some other things coming up too. We're going to talk about executive functioning before we go back to school. We've all been on these roller coasters for the summer. So how do we begin to focus ourselves back into school and definitely distance learning if that's what we're facing. So again, more things coming. And if you have something that you feel would be a good topic for a webinar that you would like to see us do, please email me and let me know that. I'm here for you, and that's what I want to do, meet you where you're at this moment. So thanks again, Kerry. Thank you, everybody, for attending.
Thank you.
We'll talk soon.
Good luck, everybody. Bye-bye.
Bye-bye.